Professor Carter has explained that it's a very diverse audience. So I'll try to make an interesting story for you and apologize if I get a little technical on some occasions. So the story begins over 250 years ago when John Hunter made the statement, "Surgery is like an armed savage who attempts to get that by force which a civilized man would get by stratagem." And what I think he was trying to say was that it's the biology of the disease that will defeat the technique. So whether you're a surgeon or radiation therapist, medical oncologist, immunologist, the dominant event that will decide how the cancer evolves will not be your technique, it will be the underlying biology. And if I say anything tonight, I will encourage you that the understanding of how the cancer patient is now treated is the understanding of the biology of the disease. In the United States, this man was one of the very first to promulgate the radical surgery that was present at the turn of the century. He was at the Johns Hopkins Medical School. He was famous for developing surgical training programs, but he was also the proponent of very radical surgery for breast cancer. And he wrote his last paper on breast cancer in 1907. And this is important because, as you can see, it's entitled Memoirs. And memoirs tend to take the information and try to make the information confirm your own biases. And what he did was he looked at a very aggressive way of treating breast cancer, where all the lymph nodes in the neck and the armpit were removed. And he noted, of course, that if there was, I don't have a pointer, but if there was, I don't have a pointer, but the important thing was that he noticed if there was an extensive nodal involvement, then the survival at the end of 3 years was very poor. He also made this suggestion, and there was no data whatsoever in his paper, this was his bias, that the liability of bone to be involved with breast cancer was related to the proximity to the breast. We clearly know that's not true, or else all of the metastatic disease, of course, would be around the shoulder. He also made the statement that the liver may be actually invaded by way of fascia in the linear elbow. And every medical student knows that. Oh, thank you very much. Oh, thank you. And he made this statement that, and every medical student knows that 25 years earlier, this gentleman in Europe had already described the drainage to the breast. So here was an example of a very famous man who was very aggressive in his approach and then tried to make his observations fit his own biases. And we still do that 100 years later. Now the other thing that began, of course, was the evolution of cancer hospitals. And many of the physicians in Brennan have had experience in the United Kingdom, and that was probably the first really developed hospital, founded in 1851 as a cancer hospital by William Marsden after the death of his wife. And that's a recurring theme. People tend to develop institutions based on their own personal experiences. This is the Royal Marsden. This gentleman was the man responsible for the institution that I work in. He was a gynecologist who first noted that a cancer hospital should be built on its own foundation, wholly independent of other hospitals. Medical board men go in with zeal determined, which is very similar to what you are beginning to develop here in Brennan. So here was a person who had the same philosophy as one of that you are now developing. If you come to New York, this is Central Park at the 81st Street. There's a picture of Marion Sims. It talks about his experience in all parts of the world. He actually left the United States during the Civil War and practiced in Europe on many of the nobility at the time. This was the original hospital, now on Upper West Side of Manhattan, still exists. although it's been converted now to apartments. There are other hospitals in the United States that were particularly focused on cancer care. One was Roswell Park, founded in 1897, and the other, the MD Anderson Hospital, founded in 1941. So our institution was founded in 1884, and some of the prominent people, this gentleman, for instance, was another person who believed in very radical surgery. He's of particular interest because, of course, he was the gentleman that operated on Eva Peron on several occasions. And this was an example of inappropriate surgery, because when Pat operated on her, she already had advanced cervical cancer, and an operation was not going to help her, but they proceeded with the operation anyway. He wrote widely about the aggressive management of surgery. So here we are now, 50 years on, still addressing cancer with more and more aggressive operations. Of course, one of the things that then developed, of course, was the identification by Marie Curie of radium and the effects of radiation therapy. A remarkable woman, first woman to get a Nobel Prize, first person to win 2 Nobel Prizes, and of course she discovered these elements, but suffered greatly because she went on to die of leukemia, presumably from her exposure to radium. But at that time it was argued quite strongly that the treatment of cancer should have been by radiation therapy. We're now 1911, the first observation. Several others describe the use of that. Here is in 1913. This gentleman, James Ewing, was actually the chief of pathology at our institution. He was the clinical director. He was very famous for describing a single tumor that bears his name, the Ewing sarcoma. And he wrote a textbook in the 30s, which at that time was the most comprehensive treatise on neoplastic disease. He was very strongly in favor of radiation therapy, so although he worked in our institution as the clinical director, he favored radiation therapy over surgery as an approach. And you can see the statement here. The person who took it further, of course, was Henry Kaplan. They were the first people to develop to use a medical linear accelerator, at least in the Western Hemisphere. And they treated this little boy who had already lost his eye for retinoblastoma with radiation therapy, and he went on to be a remarkable success and retained into adulthood the normal vision, a very important observation. The other development came from a very interesting and unfortunate event, and that was the utilization of nitrogen mustard in World War I. And the observation that these soldiers that were exposed to that lowered their white blood cell count. So now we had a treatment, at least in theory, that would address at least the tumors that involved the